Hey friends, welcome to Becca's by the Bay. I'm Becca and this is our small urban homestead here in South Texas. And I want to talk to you guys today a little bit about dental care preparedness because that's something I'm dealing with right now currently. And I was hoping this video might help somebody else out there who's going through a dental emergency, dental care treatments, and dental pain. So just to get into it a little bit, I have some seizures from some car accidents that happened to me, and we've been paying on dental care I had 8 years ago. It's almost getting close to being paid off, but it's not, and another dental emergency has come up. Such is life in all the bumpy roads that we're taking right now. So I really hope that some of this information is helpful. Please do not take any of this advice as medical care or medical treatment, and please do your own research. I'm just going to be explaining things that I have been using to help me in the process of the dental issues that I have had. I've had some broken teeth. I recently had one fracture and 2 abscessed teeth up here. Please note, this is a medical emergency. I am currently on antibiotics, and I've seen 2 dentists already, and I have a treatment plan in place coming up ahead. So, and I probably didn't bring everything out here with me, but just to kind of give you a peek at my table that I'm going to be showing you guys some of the things that I keep here on my homestead, in my pantry, my medical cabinet, things like that for medical emergencies, to just kind of get you through getting to the doctor and getting you through till the next treatment. And maybe some of this is something you might want to look into and try out for yourself. So as always, any kind of like first aid kit should always have a really good cold compact. This is a cold and hot compact. They're on Amazon, and it's by Medvice. It's kind of a soft covering, and you still want to put like a sock over it or like a towel. It's super good for reducing the swelling, helping with the pain and things like that. I know I had a dental emergency several years ago. There was about 6 teeth that broke within the same week. Ice packs are going to help you out a lot. I didn't bring everything out here, but cotton balls are really good to have on hand. And I'm not sure where my clove oil bottle is. I'm using it, I think, in our humidifier right now. But a bottle of pure essential clove oil is really good to, some people will dilute it with a carrier oil like sweet almond oil, sunflower oil, things like that. Put it on a cotton ball, and you can put it on the affected area. It can help with, you know, the bacteria, infections, swelling, drainage. It will numb the area. It was so bad the last time I had this dental emergency, I literally had cotton balls in my mouth all day with the clove oil until I could try to eat something, which was smoothies, eggs, you know, scrambled eggs, and like mashed potatoes. I did that for like 2 months while trying to get some care, which still took many more months after that. So I lost a lot of weight, and nutrition is super important. So always try to have multivitamins in your arsenal of your cabinet and things like that. Cod liver oil is really good for a lot of things. It's very, very healing for a lot of things. Oil of oregano is really good for infections, as you all probably know. And vitamin C. My medical experience from working with medical doctors, I have a dental background in licensing, is my doctor's always recommended to me personally 5,000 milligrams total in a day. Anything more than that in your body just doesn't absorb it. But you can take up to 5,000 milligrams, about, you know, 1,000 5 times a day. This really helps with a lot of infections and things like that. Another thing I'm going to talk about is, and I don't have the original box, I apologize, it is baking soda. It is super cheap. It is something we always recommended to our patients, to get a brand new toothbrush. And I mean, toothbrushes are cheap, y'all. Get the soft ones. Get the ones that are smaller head, especially if you have a smaller mouth. The smaller head toothbrushes can make those circular motions a lot better if you don't have a lot of room in your mouth, and it's way more gentler. So you're going to be making these soft circular motions all throughout your mouth for at least 2 minutes. And if your mouth hurts, you know, try to use some clove oil first. Try to do some ice packs first. And what you do is you wet your toothbrush, dip it in your baking soda, and brush your gums on the inside and outside. We told everybody this. It made a world of difference in reducing plaque, reducing infection, and having a better, less painful outcome when they were getting extractions and other treatments done in our dental offices and things like that. Use whatever toothpaste you feel comfortable with. If it's one that you make or one that you buy. I'm not going to go into the whole fluoride thing. I'm against fluoride personally, and that's just my personal opinion. Okay, so this was something at one of my holistic dentist offices. Some of you may know someone that sells this, the Thieves mouthwash. It's really good. It's got the therapeutic grade essential oils in it. This is really good at helping keep the mouth clean and reducing the infection from spreading through your system. So that is really helpful to rinse with 3 times a day. You want to brush at least minimally 2 times a day and floss 2 times a day. Another thing you can rinse with if you don't or cannot afford this, hydrogen peroxide. We would always mix it 50, get yourself a little shot glass, put hydrogen peroxide and then half water, swish it around for about a minute or so. This is really good at reducing infection. This is cheap and affordable. These are your 2 best friends: peroxide, hydrogen peroxide, and baking soda, and a toothbrush. This is what was prescribed to me. It's a clean, so this is a chlorhexidine gluconate oral mouth rinse. This was, I had a bad infection that I never really had in my gums before because I've been really sick the past few months and not a lot of different antibiotics, which I normally am not, but medical emergencies deemed it necessary for me to be on antibiotics. So I've been on probably 4 different antibiotics over the last few months since July for just several different things I had going on, and it actually caused me to have some perio issues that I've never had before, and I'm 48. I've never had perio problems. And I'm going to go into that a little bit about what I'm doing that's helped the perio besides this, or this as a rinse. I also worked with a holistic dentist, and she recommended, and I would get the raw chlorella tablets, and I take 3 to 4 times a day. So 3 to 4 tablets, 3 to 4 times a day. This is what I'm personally doing. I normally take this as a multivitamin every morning. You can up it from 2 to I think 6 a day tablets of the spirulina. Really good for you. And this is the other thing when the pandemic happened in 2020 is I purchased a Life Force Compact Easy 2 colloidal silver generator. These are available on Amazon. Super simple. It comes with it's its own battery with the plug and 2 silver rods. And I got me the amber tinted mason jars that are the ½ gallon, and what I do is this will be a sterilized jar. I fill it with distilled water. Make sure you're using distilled water because this is something you're going to have sitting around for a little bit. So you want pure, clean jar, pure, clean water. I buy distilled. And then I put my machine together and hook it together, plop it in, and there's an instruction booklet, which I seem to have misplaced, but someone was kind enough on YouTube to screenshot theirs, and it's the same model. And so that was a ½ gallon, so I did 32 ounces of distilled water, and it says to run the machine for 2 hours and 15 minutes to get 20 parts per million. There's several different parts per million you can make and check out, and the different dosages and things like that. I personally like around 20 to 30 parts per million, so I put my machine on in this distilled water for 3 hours. I seem to have lost the parts per million tester. There's a tester that you can buy separate. Not sure where I put it, but I wanted to make sure it was a little over the 20 parts per million There was a colloidal silver I bought from Amazon called ACS 200, and I think it's $20 for like a 2-ounce bottle, and that works really good for as a spray and things like that, and that's what I started off with, and I noticed a lot of really good healing results with that for cuts, scrapes, you know, other different infections and things like that, and I think I used that for a while until I could afford this. This is, I think, around $80, $85. It's under $100. It's worth it, because you can keep making the colloidal silver over and over again. Like I said, I drink maybe 6 shots a day right now, and between the time that I went for the dental visit and they told me I needed, like, not just the perio cleaning, but I needed perio medication put in the pockets. I also needed a laser treatment to laser off, and they were testing for cancer. So in the time that I've been using the colloidal silver for a whole week since my last dentist appointment, and then I had the next appointment was a week later, and they said I needed $10,000 of work, yeah, to bone graft, root canal, and some crowns, and all the perio stuff. Insurance was only going to cover $2,500, and I can't have it all done at once, so we're just going to make a game plan, and I'll kind of go into that a little bit. But what I was saying was the colloidal silver, I was taking it for a week, so the next appointment I had, after they told me all the stuff I was going to need to have done, I came in the very next day for my first perio cleaning treatment on one side, where they had to numb me. They said that, like, my gums had improved so much in one day. Now, consider, I've been taking the colloidal silver for a week, but between that week and one day, my gums were healed enough that they said I did not need the laser treatment done. So that was, I mean, I didn't care if I turned blue. At that point, I was drinking, you know, a good, 2 cups at night of this to just knock out all the stuff that I got going on, infection in my gums, the abscessed teeth. And so I was, like, really shocked that they even said that within, the 1-day difference of that appointment, and I've been taking this for a week. So I was really impressed with the colloidal silver. That's my personal experience with it so far for dental, and I'm still taking it. So let me see, was there anything else I wanted to go about talking about? Oh yes, okay, so the antibiotics will trash your guts. There's no way around it. You need it, you have to take it. It will trash your guts. So I am eating yogurt every day, and then I also make my own home-brewed kombucha, and that's super easy. You can buy it at the store if you don't know how to make it, but making it is really, really easy. And I always make something, I do a first ferment, and then I do a second ferment with some type of, I like it flavored, so I like pear with ginger spices, so I'll do a ginger pear, or I'll do a ginger peach. A lot of things I do are just ginger, whatever. Ginger's so soothing on your stomach, and just really good. I mean, you could add other herbs to this too. You could probably add a couple of cloves of whole cloves to this as well and ferment it. And there's other things you could probably add to it. And I also we had cooked up a turkey. My husband cooked up a big turkey, and so I've been making a perpetual bone broth where you put all the bones in your crock pot, cover it with water, add your apple cider vinegar, your sea salt, black pepper, turmeric, and I put cloves and bay leaf in there, the celery and onion. I didn't have any carrots. That's okay. It was more about the nourishment of the bone broth. So I put that on low, and I just, each day, I'm just, taking with my meals a good mug size to drink of the bone broth, and I've noticed a lot of helpful healing with that. It's very soothing on my tummy and in the mouth as well. It feels very soothing. So bone broth is so easy to make at home. You could do it with a chicken, a turkey, other beef, things like that. And if it didn't have enough flavoring, you could add a little extra bouillon. So each day as I drink out of it, I will add more water to it in my crock pot. And if the spices are not spicy enough like I like, I will add extra spices maybe every 3 days. I add a little bit of extra spice because you're watering it down, so you can add some more spices, and just keep it going. If you make a lot of it, you can just, strain it off and put it in some mason jars and put it in your fridge and then heat it up and drink it throughout the day with your meals and things like that. So yeah, we're gonna stick to soft foods. Like, this is rough. My mouth hurts everywhere right now. It's very difficult for me to mechanically chew on any side, and soups are your best friend. Jello is really good. Pudding, scrambled eggs, smoothies, whatever kind of smoothie. Like, if you're into the if you're depending on your intolerances or allergies and things like that, I like it's a whey protein, zero whey protein isolate that I take, and A2 milk is very healing. It has a lot more healing in it if you are into dairy and things like that. If you can get some A2 milk and put it in your smoothie. There's also protein shakes that you can buy already pre-made if you don't like the powders and things like that. Really simple soups. I'm gluten-free, so there's the gluten-free ramen soups that are pretty good, that just kind of have the brown rice noodles in it with some seaweed and a little bit of flavorings and things like that. So that's really nice to have if you want a little bit more kind of substantial. If you can tolerate some soft tuna fish, protein, think protein, because like I'm actually craving a lot of protein during this medical dental crisis that I'm actually going through. I don't want anything sweet at all. In fact, pudding is just a little too sweet for me and bothers my teeth, so I'm just sticking to the yogurt. I might put a little raw honey in there if I want a little bit of sweetness. You could put some berries in there. It's a little bit cheaper sometimes to buy, the frozen berries and stick it in your plain Greek yogurts. Whatever yogurt you like, just eat yogurt. It's really good for your tummy, like I said. So to kind of counteract, like, I'm super nauseous every day from either just the infection or the antibiotics, to the point where I really couldn't hold anything down, so everything was kind of coming up. So I'm just, the bone broth was really soothing, the kombucha was really helpful, the yogurt's been really helpful. I would stay away from ice cream. If you want ice cream and you gotta eat something, have some ice cream. But there's a lot of sugar in ice cream, so it just bothers me, and I'm not craving it. My body's needing some natural healing medicine and food, and it's just craving all the things. And I didn't bring it out here, but I'll put a list to some of the things I've gotten on Amazon. It is a beef organ supplement. It's hard enough to eat beef organs and things like that. I know I'm not really a big fan of it. I'll do it where normally, if I can eat well, I'll have beef liver wrapped in bacon, and I kind of broil that and eat it that way. But I like the capsules because they're really, it has a whole gamut of the beef organs. I think it's Ancestral Supplements is what I'm getting, or there might be another one. There's 2 different brands that are really good, and I take that every day, so that's another part of my vitamin regimen. This does all cost money. I'm sorry, I know, there's no way to get around it. So everything you see here, I'm not even sure how much it would cost to go purchase all of this right now. If you're just like really, really poor, and most of the time we all are, right? So this is something that you work on. This is something you prepare for, you prep with, you kind of have this in your arsenal of preparedness. You can always get new toothbrushes for, this is like $1 a toothbrush. It's like, what, 99 cents for baking soda, and I don't know, maybe $1 something for the hydrogen peroxide. And you can even get toothpaste at the Dollar Tree. So those alone, along with whatever pain medications you want to take that are over the counter, Advil's better for some people, Tylenol's better for some people. There's a combination Advil-Tylenol that I thought I'd be able to handle. That made me really, really ill. So I'm just sticking to the Tylenol. My stomach can't handle Advil or Advil-Tylenol combinations. It made me really, really ill, so I'm tired of feeling ill. But yeah, this is what's in my preparedness pantry, medicine cabinet for dental. There's probably other things I would like to have. I'm not even sure what that would be at the moment. Just know that whatever dental emergency you're having, you're going to probably need some type of help at some point. It gets into your blood system, it makes you sick. I think when this tooth fractured and broke, and another tooth broke the same day, 3 days later, I had excruciating pain all down my neck, all the way down my spine, as if someone was just taking a knife and drawing it and just holding it at the base of my spine and the base of my neck. And it's been like that for a little while now, and it's making me a little cuckoo. I'm not gonna lie. Dental pain will make you crazy, and you need to do the best you can to get into a clinic or somewhere to get antibiotics right away and try to get some dental treatment. And I know it's so hard. I honestly didn't think I was going to qualify for the credit care this time, because I'm still paying on the credit care that I had last time. And it was $10,000 worth of work then, and my mouth dropped open when they said another $10,000. I was like, I just cannot keep doing this. I am not a rich person, and, I'm tired of working so hard to try to pay off a lot of debt. And I want to feel good again. I want to be out of pain and feel like I can do some things again. So I'm going to have this tooth pulled, and I'm going to see about the crowns that I need done over the next year, because I'll use up the portion of insurance that I do have and qualify for, and that will help out for this one emergency. And then next year I had to switch plans, because this one won't be available next year. So next year there's less coverage. This is how things are going these days. It's 2024. We're getting less coverage on all kinds of things. So, really, I know it's hard. It's hard to stock your pantry. I know it's hard to put money aside for dental emergencies, especially if you're having like any kind of other emergency that like you just need a vehicle to be running to go to work. So I'm hoping that some of this information is helpful to people out there. Maybe you could start thinking about having some of these things in your pantry, in your medicine cabinet, and things like that, so that if something comes up, you're not like, I can't run to the store, or I'm out of money. So try to find ways to sell some things, make some extra money, to have some things on hand to make life a little bit more helpful and bearable. This is not something you want to go through. This is probably, I think, the last thing people think about preparing for is a dental emergency in a SHTF scenario. And I gotta tell you that having that scenario can affect your health in a really negative way. You could die from a blood infection from an abscessed teeth. You could die from it if you don't get some help. It's deadly. So let's just put that out there. So you need to try to do what you can to try to help yourself out as best you can. So yeah, that's it for me here today in my garden. Something beautiful. We're waiting on some rain, which we haven't had in many months. And man, I really hope it does rain today. I've got a dentist appointment tomorrow, and then that'll take care of the other half of the perio treatment that I'm getting done. And I was hoping they were going to be able to pull this tooth tomorrow, but the oral surgeon is not available until December 6th. And then if I had missed that appointment, then this is what blows my mind. The next available appointment for the oral surgeon would be after January. I can't be in this much pain that long. It's already driving me cuckoo. I don't know, I don't even live in that small a town, and I find it extremely distressing that there is not some serious access to medical care here for specialists. There's dental offices that have been popping up over the last few years everywhere in my town, and there's not that many specialists. I mean, I guess if you have cash, you can pay for anything. I don't have enough cash to pay for all of this, so I don't know about you. We're going to do what we can, and I'm going to give you my best tips and tricks for dental care needs, pantry preparedness, and all the things. And there goes the sirens. It was quiet. Alright, I love you guys. Comment below if you have any more tips or tricks on taking care of dental pain, dental care, dental needs. And we will see you in the next video. Thanks for liking, sharing, subscribing, and commenting here on my channel. I really appreciate it, and I hope it helps somebody else out there. So have a blessed day. Love you. See you next one.